set it over on the table here. And then I'm just gonna go ahead, and what I need to do is I need to retake and recharge the suction on this particular JP tube. So how you do that is you actually just take and push it down as much as you can to recharge it and get it as flat as you possibly can. And then you're gonna take your, the little insert thing here and just reinsert it. And then the suction stays on it. So then I'm gonna take this and replace it onto the patient's dressing or wherever they had it secured. Patient's dressing or gown or wherever is appropriate. Take that and reinsert it there. Okay, once I'm finished with that, I'm gonna take, and I will take this solution and I will measure it and assess it for documentation later. What I'm gonna do is, I'm gonna go ahead and just take all my dirty supplies, take off my clean gloves, and get rid of all of this equipment. And then, once I'm finished with that, I'm gonna go ahead and take care of the colostomy care. So I brought the supplies in for me to take care of that. And what I'm gonna do is just get those out of the container here and get set up for that. And then I'm gonna go ahead and I'm gonna get some water for this. And then I'm gonna go ahead and wash my hands before I start this procedure. I got soap and water in there. I'm gonna take a pair of gloves and I'm gonna go ahead and get started on the next procedure. So take and put on these gloves. And then I'm gonna go ahead and take off the colostomy bag. So I'm gonna loosen it up, it needs to be changed. Take it off my patient. Off, and I'm going to go ahead and get my receptacle to put it into. I'm going to put it down in there and take the clip off, and you can either keep the clip or get a new one as needed. I'm going to set that over here on the table and get rid of this and measure it and take care of assessing all of that for my I&O. Once I'm done with that, I'm going to go ahead and clean with either, if the area is not irritated, I can just use soap and water on the skin. So I'm going to go ahead and do that. I'm going to use soap and water around the area. If the area is irritated, then I can go ahead and just use plain water. I'm going to clean up the skin and the stoma and get it completely clean. If I've used soap on it, I want to go ahead and just make sure and rinse that off. Get that all cleaned up. And I will go ahead and dry the area. And leave my towel here for if it happens. Okay, if my hands are soiled, I'm going to go ahead. I'm going to remove my gloves again, get rid of those, and I will go ahead and wash my hands again, get them all cleaned up, and put on a new pair and prepare the new bag to put it on. Fresh gloves. And I can also wash this with soap and water if needed, the clip. Then I'm going to go ahead and get the measuring piece out, and I'm going to go ahead and measure the stoma so that I can make the hole just the right size. I'm going to measure it and be sure that it fits around it the best. And then I'm going to take my colostomy bag, actually, and just see how it's going to best fit on there. so it's easy for the patient to use and empty, etc. So I'm going to take that and set it down, and I'm going to go ahead and mark the proper size on my colostomy bag with my pen. Make a circle on here, and then I'm going to go ahead and cut that out, making sure I don't cut the plastic on the other side. Cut out the right size around here. Once I get that cut out and prepared for the patient, I can go ahead and apply the clip onto the end of the bag so that it's tightly placed on, making sure that it's tight and firm, that it's in place. Okay, so that's all ready to go. And then I'm going to go ahead and assess the area again to make sure there's nothing else I need to clean up. Then I'm going to take my my skin protective, and it also provides some stickiness along the area to help it stay in place. I'm going to open that up and take it out and apply that to the patient's skin and allow it to dry and get tacky a little bit. So give that just a couple minutes, and it'll become tacky, and then it'll help the colostomy bag stick. So while I'm doing that, I'm just going to take the backing off of the colostomy bag and get it set up to go onto the patient. So once that's sticky and all tacky, then I'm going to go ahead and set the colostomy bag on, fit it over the stoma, and just apply and press down on the adhesive around there, and see that it gets nice and firm and there. There's also a tape around the edge that I'll take the backing off of that, and then that sets on the skin. So I'll do that, and while I'm doing that, I just constantly keep pressing on this, or you can have the patient press on it to make sure that it stays firmly placed onto the skin. Take this taping around the edge, place it firmly down onto the patient's skin all the way around. And again, just making sure that everything is intact so that there are little chance of leaks. So once that gets completely put on and it's in place, you're going to go ahead and clean up your supplies, make your patient comfortable, and then you're going to go out and document your I&O as well as the procedure that you completed.